Hello everyone, we are at New Millennium Medical in Belvedere, and today I'm joined by Kathy Seisel, and we are going to be talking about all things physical therapy. So I know we have talked about chiropractic care in the past. So to start things off, talking about physical therapy, but I know we also have talked about chiropractic care. So what's maybe kind of the difference between them, or how are they similar?
So chiropractic care is going to focus on restoring joint mobility and alignment, while physical therapy is really going to focus more on restoring range of motion, balance, strength, and maybe also working on functional activities.
So what kind of patients would benefit from physical therapy, at this clinic?
Well, everybody would benefit from physical therapy, but our clinic really specializes in patients from the adolescents all the way up into senior citizens. We'll typically see patients following post-operative fracture care, motor vehicle accidents, musculoskeletal injuries like sprains and strains, workman's compensation, and also sports injuries.
And that leads perfectly into my next question. As we were talking before this, I had a sports injury and needed physical therapy. So how do you approach, those sports, injuries when it comes down to it?
So the first thing you need to do is really identify what the athlete's demands are from sports. So for instance, a baseball player is going to have different demands than a football player. But even within that sport, a pitcher is going to have different needs than somebody who's a catcher. Mm-hmm. And those things can depend on, again, are they in season, are they out of season, and, have they had surgery, or, they just had an overuse injury.
And I know it can look different for athletes, but what about, for somebody who had just gotten surgery? Could that look different for physical therapy too?
Absolutely. So after surgery, primary focus right afterwards is going to be making sure that their pain is under control and that we're getting some of that swelling down. As they're starting to feel better, we're going to start to incorporate motion, maybe weight-bearing exercises if they've had knee surgery, and then really progress with strength and conditioning, and then working on tasks for function, so squatting and lifting activities.
Yeah, and to top it all off for you, is there maybe a difference, or maybe could a patient use, both physical therapy and chiropractic care at the same time? Is that a benefit, or how does that look?
Absolutely. Even though we do different things, they're very complementary in nature. Mm-hmm. And so by incorporating both chiropractic care and physical therapy, we actually have quicker results, and patients do really well in the long term because you're getting both of those avenues at the same time.
Right, yeah, and I can attest to that as somebody who went through physical therapy. It scared me at first a little, but it really does help in the long run. So I just wanted to thank you so much, and I appreciate you talking to us
You're
today.
Welcome.